Every other Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now to talk about the newly announced Alzheimer's drug that was just approved. Good morning, Dr. Brady.
Good morning, Kelly.
Okay, so exciting news on the Alzheimer's front, but can you tell us first, break down what exactly is Alzheimer's?
Alzheimer's is the most common form of dementia. It affects 6 million Americans in our country today. And it's a very serious disease because no medication thus far actually affects the disease progression. So there are medications that help with the symptoms, but they don't reverse the disease and they don't stop it.
Okay, good to know. So then when it comes to this new drug that was announced and just approved by the FDA, what exactly is it and how does it help people?
Aducanumab, or Aduhelm as it will be marketed, is a monoclonal antibody, which is a synthetic medication developed in a lab, and the FDA is still debating the safety of the medication, although Alzheimer's Association and a lot of specialists in Alzheimer's are clamoring for this medication because this is the first medication that may actually slow to stop progression of the disease, which is the deposition of plaque in the brain. And so there is debate on this at the FDA.
Yeah, and speaking of, there has been some fallout of it. I believe 2 members now from the committee have resigned after this drug approval. So why exactly is that? What's the debate there?
They don't feel that there's been enough research showing that the drug is effective. And despite the trials of thousands of Alzheimer's patients, they don't feel that they've shown it to be completely effective.
Okay, interesting. And it's not a cheap drug either, very expensive to go through the treatment. So can you talk a little bit about that? And for those who are, hearing that, wow, an Alzheimer's drug was approved, what exactly that can mean for them?
It costs about $56,000 a year to administer the drug. That doesn't include the recommended monitoring of the drug, which includes 2 brain scans in the first year to make sure that the brain is not swelling from the drug. So we're talking tens of thousands of dollars per patient. However, in the benefit side of this medication, it may actually halt progression of the Alzheimer's in patients. And so with 6 million suffering from Alzheimer's and many more coming with the aging of America, there's much hope. But as you say, other people, experts in this medication, have resigned from the Food and Drug Administration because they don't feel that it's necessarily proven safe. Now, this is a big change from the COVID vaccines, which are approved and generally safe. So Americans have been debating the safety of the COVID vaccines. Here is an example of the FDA approving relatively safe COVID vaccines so that you don't die of COVID. Aduhelm, the Alzheimer's medication, is promising at this point.
Okay, and you briefly mentioned the COVID vaccination. Do you see the FDA approving any of the vaccines?
The COVID vaccines? The COVID vaccines are approved.
All by
And
the
as a
FDA.
matter of fact, they are looking at approval in pregnant women and women who are breastfeeding, as well as going down in age to infants and toddlers as a safe vaccine. Those may actually be shown to us in the fall that they're safe for these populations.
Okay, good to know. All right, cool. Thank you so much, Dr. Brady, for joining us, breaking that down. I know a lot of folks, of course, as they're hearing about this Alzheimer's drug, very interested. And I know it's a hefty price tag, but when it comes to having your long-term mental health, I mean, health is wealth. So for a lot of folks, of course, it's going to be worth it, and they'll jump right on it. But thank you so much, Dr. Brady, for joining us. And hopefully it does do all that they are hoping it will.
Yes, indeed.
All right. Thanks, Dr. Brady, and we'll see you next week.
Yes, indeed.
Okay, wonderful.